Welcome back to another sci-fi episode where psychology and finances collide. Today, we'll continue to examine how we think, feel, and behave with money as it relates to chronic financial pain. So truly, welcome back to the Pain Management Clinic. The last couple episodes, we talked about the different behaviors that lead to chronic disease, that lead to premature death. And then we did a little spin on financial chronic pain, the 3 behaviors that lead to that, such as poor budgeting, high credit use, financial inactivity, that lead to 4 chronic financial conditions, such as debtflammation, depression, instability, anxiety, which results in a premature death of your personal financial sovereignty, or premature retirement, or forced retirement, or delayed retirement, you name it. So we'll continue to talk about those things from a chronic financial pain perspective, but also continuing it to bring in the concepts of what you might be more familiar with the chronic pain management industry, just to kind of bring it a little more to light and feel more approachable as well. These are real issues that cause real pain that can receive treatment to reduce your pain and suffering. With this segment, in this clinic, we're going to be talking about adherence versus non-adherence or poor adherence to the prescribed treatment plan or financial action plan. And the reason I want to discuss this is because I see so many clients in the financial session where they get excited about the financial action plan. They're ready to work through this. And just like you would see with the chronic physical pain population, the motivation steadily wanes over time, and what used to be a motivated plan to adhere to the treatment plan or action plan turns into non-adherence or poor adherence. And probably in chronic financial pain, we don't want to use the word poor adherence. We want to steer clear of that word poor because some folks' minds might go to, again, I'm broke. So lack of adherence or little adherence. In the chronic physical pain world, there's a statistic that 60% of Americans have at least one chronic condition, and 40% have 2 or more chronic conditions. And again, that causes a level of sadness because there are so many preventive factors. And this isn't to blame people who do have a chronic condition or multiple chronic conditions, but there are so many things that can be done to relieve some of the issues. And that's where we want to go with the chronic financial pain analogy as we move forward. After we've revisited those 3 behaviors, so again, those 3 behaviors of chronic within the chronic financial pain that lead to 4 chronic conditions, which lead to premature retirement, delayed retirement, or premature death of your personal financial sovereignty, let me talk a little bit about the behavioral activation that we discussed last time. We want to move towards a behavior that brings meaning or enjoyment. And that same technique can be useful to increase adherence to your financial action plan. And maybe you've never seen a financial counselor. Maybe you thought that was not within the budget to pay someone. But of course, remember here at Redstone Arsenal, if you are a Department of War or federal civilian or military retiree, active duty member or family member, you have access to me for free. This is absolutely at no cost to you. But yeah, there are some folks too that think, oh, if I receive financial counseling, it must be through a financial advisor, but they're very different people, very different professionals. Now, sure, a certified financial planner who also tends to be an advisor can provide some level of financial counseling. But the financial counseling that I provide is more laced with education and how-tos and actually creating a financial action plan for you to move towards the direction of finally getting to a place where now you can hire an advisor, such as a certified financial planner. So really what I do is I provide the legwork and the framework and the scaffolding to get you to a place where the certified financial planner is like, yes, this is exactly where I want to meet my clients. They're ready, they're engaged, they got their spend plan, their debt is under control, and they truly have the ability to invest in different ventures. We need to look at what Dr. Rachel Allen presented in this class as common non-adherent behaviors. So when you receive that financial action plan, whether it's through your bank financial counselor, which be leery because sometimes they will provide you free financial counseling, but will attempt to sell you products that you may or may not need, but all you have to do is say no to any products. You just want the free education. But here are the common behaviors that lead to non-adherence of that treatment plan or that financial action plan. And 4 out of the 5 I see in financial counseling. So number 1, chronic physical pain patients tend to skip appointments, or they don't adhere to self-monitoring or to lifestyle recommendations. They don't adhere to referrals or specialty care, or there's medication non-adherence. So we can see that definitely within the physical pain perspective. But now let's, again, go back to chronic financial pain, where financial clients will also engage in skipping appointments. They'll no-show, they'll cancel, they'll delay follow-ups. And guess what? That is normal. That is expected. Most counselors, therapists, psychologists, psychiatrists, physicians, any provider, any counselor that you can name knows that that's just part of the process, because we understand that so many took a long time just to make that appointment. And then they finally show for the appointment. They get the education, they get excited, they get motivated, but one appointment, one visit isn't going to change their world. We would hope that it would, but we understand that it doesn't. So there is a lot of non-adherence to follow through with appointments. So I want to validate that for you. If you've ever engaged in financial counseling and then you got excited, and then you just couldn't muster up the motivation to go back. Maybe the counselor touched some nerves or some triggers and other things where you, instead of challenging your thinking, it only reinforced your negative thinking, and then you felt more like a failure, and I just can't go back and show my face to someone where I have once again failed. We get that. So please don't beat yourselves up too much. There's still time to reschedule your next appointment. Come in, and with that knowledge, know that you're not going to feel like going to every single appointment. And then there's number 2, the non-adherence to self-monitoring, where there's this infrequent monitoring, where you're not tracking your spending or your budgeting, or there's inaccurate monitoring. And I see that when you're throwing out guesses and numbers on your budget and your spend plan, and you're relying on the mental accounting rather than true data. So inaccurate monitoring. Or there's this avoidance altogether. And again, before session, I will challenge people to complete certain data gathering assignments or experiments because I choose not to enable your avoidance. And that's a good thing. It's a technique. It's a wonderful way to get you accounted for and someone to be accountable to. It's very effective. And then there's number 3, non-adherence to lifestyle recommendations. And of course, in the physical sense, folks are like, oh, I'm not going to follow this diet. It's the same with a budget. You see the financial counselor, oh, I can't. This budget is more like a diet rather than anything. And so many financial professionals are seeing the relatedness between, or the similarities between, disordered spending and disordered eating. There's this restrict and binge cycle. Even with spending, you restrict so much. I'm going to stick to this budget, never reward yourself, never give yourself the want and only focus on needs. Well, that can lead to binge spending. So, and also within that non-adherence to lifestyle recommendations are just inactivity. You're just choosing not to do the thing, the homework or the experiment, or you continue to engage in that avoidance behavior. And then your stress increases. And then from that stress-induced non-adherence, now you're increasing your suffering rather than decreasing your suffering. You're not setting financial boundaries with people, and which could lead to self-medication. And that could be using your medications outside of the intended prescription or strength or dosage, or you're engaging in increased smoking, alcohol use, or other substances. And so you can see, again, the similarities with pain management and non-adherence between the physical and the financial world. And number 4, non-adherence to referrals or specialty care. So a lot of my clients, I see this where they really need to plan their estate. Perhaps they have younger children, they're worried about guardianship, they don't necessarily if something happened to the both of them at the same time, they don't want to follow the state's protocol and who would be the guardian over their children. And so I let them know, hey, you can do that through a will. You can appoint a guardian that way, but it's just another expense. And so sometimes there's just not that follow through. Or hiring an advisor, someone who actually is at that point where they can now go see a certified financial planner or even a certified public accountant or a tax professional. A lot of folks will not follow through with those referrals or specialty care because they have this thought, it's going to cost more money. I don't know if that outweighs or if that benefit outweighs the cost of actually paying for something further. Yet then you'll see them out at dinner spending or dropping $200 on a meal. And so again, opportunity cost, it's your decision. And then number 5, medication non-adherence. And I'm not going to talk about that one because, medication non-adherence can impact your financial chronic pain if you have some pre-existing issues and if you're not taking your medication as prescribed. Perhaps that could lead to impulsive spending behaviors, or it could lead to lack of motivation and perhaps a depressive episode, then you do nothing. Or if you don't take your medication as prescribed, perhaps you remain overly anxious and you strive, and realize even with all the striving, nothing is happening. So we want you to be healthy and happy as you're moving forward. And again, with any chronic pain specialist, they'll remind you that it's not necessarily about getting rid of the pain 100%, but learning how to move through the pain and reduce your suffering. And that's what we want to do with this education today. So what do all of these non-adherence behaviors have in common? All 5 of them. They can all be organized. They can all be planned. You can use some self-management practices here. And this is what I try to get my financial clients to focus on. These things that could potentially cause you to miss appointments or not follow up with a referral or not follow up with specialty care, such as with a tax planner, etc. All of these things can be organized and planned in such a way where you are increasing your self-efficacy. And anytime you increase self-management or self-efficacy, you reduce suffering because it simultaneously sends messages to your brain that I have some level of control over this. It's a good thing. I like to move my clients towards financial action plan adherence by moving them towards this self-management, actively managing symptoms or behaviors or treatments, and understanding the physical and psychological consequences if they don't and if they do, and what kind of lifestyle changes adherence could lead to. And again, that improves self-efficacy over time. So there are some barriers to adherence, even if we plan these things out and you're saying, Olivia, wow, one of my bigger things is skipping appointments. I've had a tax professional lined up for the last 2 years and I've made the appointment. I've gotten my forms ready for the appointment, but I just didn't go. And a lot of times that is fear-based. And again, that avoidance is part of that pain cycle. And we want to interrupt that pain avoidance cycle. So this time around, perhaps you're thinking, I would love to finally follow up with a tax professional and get all these things in order. And I wish that it were as easy as just saying, okay, I'm finally going to do it. But I want to give a little further validation as to why, even if you told yourself today, okay, I'm going to listen to this, I'm going to get everything organized, I'm going to put it in my planner. But there are some other barriers, just to validate for you: patient-related barriers, treatment-related barriers, condition-related barriers, and system-related barriers. And so again, just validating for you that does create a level of difficulty that could lead to further non-adherence to your action plan. Now, obviously, I'm a financial counselor. I'm not providing clinical therapy, so I'm not going to call you a patient. But client-related barriers when it comes to chronic financial pain, that deals with knowledge deficiencies. Even a provider for physical chronic pain would say the patient-related barrier is that they just are deficient in their knowledge regarding the condition or the disease. And I think I may have shared this in a previous episode way back, but when my oldest was diagnosed with cough variant asthma, I had no idea what asthma truly was, especially cough variant asthma. And so when we were prescribed the inhaler, I had no idea how to use it. No one in my family has ever used it. The only people I've ever been exposed to that have used an inhaler was probably a fellow student in class, but never really paid attention or observed how to administer it if they couldn't, and things of that nature. So I completely felt inadequate and just I don't know how to do this. I'm going to definitely need some extra education. And so many times you do have to speak up. You have to understand, what am I dealing with here? And guess what? A lot of patients and even a lot of clients in the financial chronic pain world, they don't ask follow-up questions. And so it's my job as a financial counselor. What am I seeing or observing that perhaps you're not really understanding? But how do I tackle that without insulting your intelligence or making you feel less than? as a consumer, as someone who will be seeking financial counseling at some point in your life, even if it's financial advising, ask the question so that you can fully understand the issue that is presented. It's better to understand your condition, like especially if you're an overspender. Geez, Olivia, and by the way, there are episodes on overspending within this podcast, and it gives some brain science and it validates how it works on the same wave as addiction. So understanding all of that can help you move towards a true action plan that would motivate you to do something different. If the client-related barrier in the financial counseling world is a knowledge deficiency, then I need to move you towards financial literacy. There are so many financially illiterate teenagers, young adults, geriatric folks who have no understanding of basic credit use, who have no understanding of responsible borrowing. And there is an epidemic of over-indebtedness in America today because we've learned how to spend credit and not cash. So we need to become more financially literate. And that is the way to overcome this client-related barrier with knowledge deficiency. So financial literacy is there to help you understand the magnitude of debt, how it works. And a lot of folks that are financially illiterate attempt self-treatment or illegitimate treatment and don't understand the difference between debt consolidation or debt settlement, or the difference between what a certified public accountant can do for you versus what a tax settlement company cannot do for you. The financially illiterate, and I know that sounds like a huge insult, but listen, I was there, and so I'm just going to not even try and sugarcoat it. I was there. I was completely financially illiterate when I graduated high school and remained financially illiterate until I was 22, even with my then boyfriend, who is now my husband. Even with his financial education, there were some things that I just didn't get, that I didn't grasp until 22. And it wasn't perfect at 22. My husband will attest to that. And so we remain financially illiterate in some areas, even throughout the lifespan. It's a matter of constantly seeking education on how to improve yourself financially. And I'm still not perfect, y'all. It's okay. So there will be moments where you need to fill in those gaps of financial education. And then there are also clients who don't understand that water cooler financial advising is dangerous. And they don't understand that budgeting is recommended throughout your lifespan, not just when you don't have a lot of money. Or folks don't understand the implications or consequences of not adhering to a financial action plan, especially if they've been referred by their security managers for a continuous vetting report. So we want to make sure they retain their security clearance so that they can keep their job. So we have gone over in today's episode the difference between adherence versus non-adherence versus little to no adherence and the in-between. And we've discussed the 5 common non-adherent behaviors, and then we've addressed one of the barriers to that adherence, which is the knowledge deficiency. So make sure you return for the next chronic financial pain clinic where you can further explore what those barriers to adherence are so that you can finally feel free enough and educated enough to finally pick up the phone and make that appointment with a financial counselor. I hope this has been helpful. Please remember to rate and review the pod wherever you listen. I'll see you at the next clinic.